This is
Make It Plain.
Make It Plain. MIP.
With Masamela Matfumo.
Mark Thompson. Make It Plain. Get woke.
Ladies and gentlemen, we welcome back to Make It Plain the Surgeon General of the United States, Dr. Vivek Murthy. Dr. Murthy, welcome back to Make It Plain. How are you, sir?
Thank you. I'm doing well. I'm glad to be back. And how have you been?
I've been okay, hanging in here, watching as everyone else has, with great concern and caution, these, or at least the Delta variant, if there aren't others, and some of the other things that are going on. And I know today you want to talk to us about booster shots. And I think last we talked, we weren't sure yet if or when, but now we've got the answer to that, don't we?
We do. Hey, if I could rewind for a second, I would tell you, you asked how I was doing, and I didn't give you the subtext behind that, which is that I'm doing well overall. But today I've got my kids on my mind because there was a case, at their school, and my son's class has to quarantine, and so we're trying to figure out how to juggle everything with childcare. And I just mentioned that because this is real life for all of us, right? Just going through all this stuff, trying to figure it out, how to, be a good mom or dad, how to be a good son or daughter, how to make it all work. And so it's real over here. And thankfully, our kids are fine and they're great. But it gives me an appreciation for what parents are going through, around the country as they get their kids back to school. But the booster shots that you asked about, this is, I know, the topic that's been in the news a lot the last couple of weeks in particular, but even for months before that. So let me put the boosters in context. The booster shots, number one, are meant to extend the protection that people have already been getting from the vaccines. It's kind of like when you put gas in your car and it helps your car run, but then you got to refill at some point. It doesn't mean the gas didn't work. It means that you need a refill. And we see this actually with a lot of vaccines, that sometimes you need multiple shots to get a sustained level of protection. And sometimes you need booster shots over time to keep your level of protection high. And right now, the recent recommendations from the FDA and CDC are as follows. If you've gotten the Pfizer shot, and if you're 6 months out from that, and if you're in a higher risk category, you can now get a booster. So what does it mean to be in a higher risk category? It means you fall into one of three groups. Either you're over 65, or you've got other medical conditions that put you at higher risk for bad outcomes with COVID. And those include conditions like heart disease, diabetes, lung disease, obesity. And the third category is that you either live or work in a place where you're at higher risk of exposure to COVID-19. That could mean you're a healthcare worker. It could mean you work in a grocery store. You might live in a homeless shelter or incarcerated population. So these are the folks who are eligible. And one last thing I'll just say is that we're talking about the Pfizer vaccine recipients here. But obviously, there are millions of people in America who've gotten the Moderna vaccine and the Johnson & Johnson vaccine. Their health matters just as much. Their protection is just as important as anyone else's. And so what's happening right now is that the Food and Drug Administration, the FDA, is working closely with Moderna and J&J to get their data on those booster shots so they can assess it quickly and then make a recommendation for people who got Moderna and J&J about their boosters. I think it's very likely that they will require booster shots, Moderna and J&J recipients. It's just a question of when, and the FDA is working as fast as it can to get and process that data from the companies.
And first of all, thanks for sharing about your children and your family. That's another issue we've covered extensively with Randy Weingarten, the president of the American Federation of Teachers, and others. As these schools reopen, we know what our kids have been exposed to. So thank you for raising that. Glad your kids are safe. We hope that all other kids are safe as well. When we talk about these boosters, though, do we have confidence that these boosters will help in terms of protecting people from the ongoing spread of the vaccine and the current variants that are out there?
Yeah, it's a good question. And fortunately, we do have a growing body of data, including from Israel, which is actually about a month or two ahead of us in terms of administering the vaccine. They started earlier than us, and they actually have been boosting people. And so we have data from them about the impact of the booster. And what's really interesting is that it does look like the boosters are very effective in protecting people against COVID-19, against the worst of COVID-19, the hospitalization, severe illness, but even against mild to moderate illness. And why does this matter? Well, here's why. It's because obviously the most important goal of the vaccines is to keep you out of the hospital and to save your life, hands down. And thankfully, they've been doing that. The booster will make sure that protection continues. But we also know that if you get a moderate case of COVID-19, you could be down and out for weeks, right? We know that when people even get mild to moderate cases, that they can have something called long COVID syndrome, where they have fatigue and chest pain and shortness of breath for weeks and months, after their infection. We know that even mild to moderate cases mean that people get pulled out of work and they have to quarantine. And that means that workplaces and schools can be at risk. So reducing the number of cases we have is what the boosters will help us do. And there's evidence already from Israel that that's exactly what they are doing. And finally, about the variants, the good news is that the vaccines we have been effective against all the variants that we've seen to date. Some more effective than others, but all overall quite effective, in keeping people especially out of the hospital and saving their lives. We've been fortunate in that regard. Now, nobody can predict the future entirely. And part of the reason we've got to get COVID under control is so that we reduce the risk of new variants developing down the line. Because, over time, it's very possible some variant will come up that may evade the protection we have from the vaccines. That's why we've got to move really fast to get cases down, not just in the US, but around the world.
More MIP after this message. General Murthy, what about cases in the U.S. in general? How are we doing overall? Are cases on the rise? Have they leveled off? Are they in decline right now?
Well, I'll tell you where we are. So as we speak, cases are declining in the United States, but they still remain at a pretty high level. We peaked in terms of a number of cases per day with this Delta variant, this latest variant of COVID-19. We peaked somewhere around 150, 160,000 cases per day. And we've been coming down. So we just dipped under 100,000 cases a day, which is good. But what really matters is, do we keep going down? And what's going to determine that is, frankly, what we do, right? So if we take precautions like wearing masks when we're in public indoor spaces, like getting vaccinated as quickly as we can slow the spread of this virus and get cases to come down and stay down. But it really does depend on what we do. We've seen, though, I got to mention, Reverend, we've seen, some of this before, where cases have gone up and then they've come down and then they've gone up again and then they've come down again. And so what we didn't have, though, last year when we were experiencing these surges is we didn't have the vaccines, right? And that can make the real difference here. So that's why we got to make sure we get people vaccinated as quickly as possible. And with all the focus on third doses, what we can't lose sight of is a top priority is actually still getting people who are unvaccinated their first doses, right? And that's why we've all of us who are vaccinated need to get the message out to our family and friends that this is the time to really protect yourselves, especially in the face of the most contagious variant that we've seen to date, the Delta variant. And those who are not vaccinated, I would just urge you to consider that we've now got a lot of experience with these vaccines. Hundreds of millions of people in the United States and around the world have had these vaccines, and they've done remarkably well with them. What we know is that they've been protected, to a great degree from severe illness, hospitalizations, and death. And we also know that they've remained remarkably safe. And all these myths that are out there, that the vaccines may cause infertility or that they may cause mutations in your DNA, these are not based on fact. They are fiction. They have not proven to be true.
Yeah. More MIP after this message. And folks, just to add to that, there's new evidence now that speaks of all of the different websites and social media platforms that have so many fake accounts that are spreading disinformation. So as much as you are aware in terms of doing your own research on the vaccine, also be aware and do research on how many fake accounts and disinformation accounts are out there as well, and be sure to discern that. General Murthy, we're out of time. I do want to mention, though, what I did not mention the last time we talked, and I have not mentioned heretofore, and I do want to mention our audience. You have lost 7 family members to COVID, and I'm not saying that to take you through anything, but I just want my audience to know that you're someone who is very well aware of the impact of this virus, how serious it is, and yet you continue to work every day in this space to prevent others from losing their lives and losing their loved ones. So I just want to acknowledge that and lift you and your family up in prayer, and I hope others will also. Okay, sir.
Well, I so appreciate that, sir. That's very kind of you, and I will certainly keep you in my prayers as well. But I'll tell you that we have lost family members. We know we're not the only ones. There's so many people who struggle with great loss, and because of this pandemic. I'm just grateful that we have a pathway out of it. And thank you for letting me share what I did earlier, also about what was happening during our day today with their kids. But I'll tell you one thing I'm grateful for is that because of the precautions our school is taking, they're making sure kids wear masks, or making sure that we do regular testing. They're making sure that they're improved the ventilation in the school so kids are at lower risk. Those are the reasons why, we can go to sleep at night knowing that all possible measures are being taken to keep our kids safe. And I just want to make sure that schools around the country are using the money that's been made available through the relief bill to actually put those measures in place. Because what could be more important, right, than the health of our children?
Yeah, I wish some of these governors and some of these states would heed your advice, but we're going to continue to work on that.
Absolutely. Won't give up.
Surgeon General Vivek Murthy, thank you, General. Great to talk to you again. And folks, just to be clear, Pfizer boosters are available. Hopefully soon come. Moderna and Johnson, be on the lookout for those as well. I guess too, is this going to be like, we may not know yet. I know we got to go, but do you think that this may end up being like the flu shot? I think Moderna was already developing something that had both COVID and a flu vaccine in it. Are we going to be looking at an annual COVID shot, do you think?
Well, that's a great question. We don't know yet. It could be that it could be that you get your 3 shots and you're good for years. That's how a number of other vaccines work, like the hepatitis B vaccine. Right. So we'll have to see. Time will tell. But the key to remember is that you can get your flu shot at the same time as you get your booster shot. We don't want anyone to delay their flu shot. And the other thing to know is that there are even more places to get your vaccine now than there were 6 months ago. Tens of thousands of pharmacies, including CVS, Walgreens, and others, carry them. A lot of doctors' offices, have the Moderna vaccine. When that, booster comes around, you'll be able to go to your doctor and get it. But the bottom line is, if you want to know where to get your booster shot, just go to vaccines.gov, put in your zip code, and you will find places around you where you can get that 3rd dose.
And if one is Moderna or Johnson and the booster isn't there yet, can they still go ahead and get their flu shot while they're waiting for the booster?
Absolutely. Yep. You can get your flu shot. Yep.
All right. Surgeon General Vivek Murthy, thank you, General. Looking forward to talking to you again as we continue to fight this pandemic, okay?
Absolutely. Thank you, my friend, and thanks for everything you do.
Thanks for getting woke and listening to Make It Plain. Please remember to listen, like, and wherever you get your podcasts, please give the show a 5-star rating. And please do spread the word. Let's all continue to pray for each other during this pandemic and this police-demic. If all hearts and minds are clear, it has been made plain.